Who hasn't suffered this fall from coughing, sneezing, and feeling just horrible? But feeling bad doesn't necessarily mean a trip to the doctor's office. So when should we go? And how can we tell the difference between the common cold and the flu? Well, joining us now is Dr. Shane Spites with UAMS AHEC Northeast. And thank you so much for being here.
Good to be here. Thank you.
Can we really tell at this time if the flu is here? Is it too early for the flu? Right?
You know, it's difficult to tell based on symptoms. But right now, statistically, there's not been a single case in the state of Arkansas, with the exception of 3 cases of individuals that came in from outside of Arkansas. So statistically, really no influenza in the state of Arkansas at this time.
So now what's the difference between a cold, the common cold,
right,
and the flu, as far as how can we tell?
And that's a huge question. I'm actually getting over the common cold myself. I had the cold this weekend. I didn't have influenza because I could really tell the difference, but of course that's why I went to medical school. The common cold, you may not feel that good, really no fever, cough, congestion, a little bit of runny nose, sneezing. Those are common. Influenza will pretty much knock you down, and it'll come with an abrupt onset, usually higher fevers. The onset's going to be pretty quick and pretty immediate.
You want to just go lay down.
That's exactly right, and kind of lay in bed. And remember, as far as the common cold, there are 150 to 200 different viruses that cause the common cold. And so it's important to know that even though you get that and get over it and may get another one again, those are likely different viruses. They're not influenza.
So how should we go get a flu shot? How important is that?
Definitely. Everyone should get a flu shot. Everyone 6 months of age and older should get a flu shot. It is just paramount to be able to prevent disease and to prevent deaths nationwide that everyone get a flu shot. A lot of people think that, well, I'm a middle-aged guy, you know, I really shouldn't worry about getting the flu vaccine. I'm not going to get that sick even if I get it. And to be honest, a little bit of that is true. But what happens when you're around that 4-month-old, that 2-month-old, that 5-month-old that can't get the vaccine because they're too young? Now all of a sudden, that's exactly right. If you're ill, you can be ill up to 24 hours or more and not even know it. And so you're shedding that virus to people that maybe can't fight off the flu just like you could.
So perfect opportunity this Thursday right here in our community.
Right here, a free flu vaccine clinic at the ASU Convocation Center put on by the Arkansas Department of Health. Starts at 9 o'clock in the morning, goes till 4. If you have an insurance card, you can bring it. They'll bill your insurance. If you don't worry about it. Just come out there and get a free flu vaccine. They have the flu mist as well as the vaccine. They'll have both forms available.
All right. Yellow entrance.
Yes, ma'am. Yellow entrance.
We appreciate you, Dr. Spites, for being here today.
Thank you for asking me.
Thank you.